How's it going, guys? We have a medium difficulty question for Pharm, steps 1 and 2. Even though the answers are very step 1-esque, this diagnosis, you gotta fucking know this for 2CK, right? So, a 24-year-old woman, 3-day history of bilateral knee and elbow pain that she describes as very achy and migrating, 2-day history of a lesion on her finger, and her vitals are normal. Then the question is asking not only the most appropriate pharmacologic therapy for this patient, but if we had theoretical resistance to this treatment, what would the mechanism be? All right. USMLE is not going to ask you a double-ish question like this. I'm just doing it for your learning, but it's two birds with one stone. Let's just hop through. DNA synthesis inhibitor, altered eukaryotic thymidine kinase, wrong fucking answer. All of these DNA synthesis inhibitor answers are fucking wrong. Okay? And the reason is because this is not herpetic Whitlow. You need to know that HSV 1 and 2 can cause infection of the finger, literally, okay? For some of you, you know that. Some of you are like, what the hell? Herpetic Whitlow, okay? USMLE likes to give it in dental hygienists, especially, but you can get a lesion that looks kind of similar to this on the finger. You don't get arthritis with herpes 99.99% of the time, okay? And you classically will get a fever. For a primary herpes infection, you can get a fever, you can get lymphadenopathy. Okay, if it's not a primary infection, if this had been inoculated, let's say from the inoculated from a patient's cold sore, as an example, that would not give you a fever or lymphadenopathy. But you're not going to get arthritis with herpes infections. Okay, but you would treat herpetic Whitlow, even though it's wrong in this case, you would treat herpetic Whitlow with acyclovir or valacyclovir. It's a DNA synthesis inhibitor, causes chain termination, and the mechanism of resistance to that drug would be altered viral thymidine kinase. Not correct in this case, but that's exceedingly high yield for USMLE. Now let's proceed. Choice D, inhibition of cell wall synthesis, production of extended spectrum beta lactamase. Correct answer. Diagnosis here is disseminated gonococcal infection. Okay, and you have gonococcal arthritis, and you've got a cutaneous pustule slash papule. This is a pustule. Okay, so this is really high yield for gonococcus. There's two main presentations on USMLE. They don't have to mention urethritis. We're talking about disseminated right now. They can say monoarthritis of a large joint, such as the knee. Okay, they can just say 24-year-old dude is sexually active and he's got a arthritis of the left knee. No other information. You got to think gonococcus is possible in that patient. All right. The second presentation, they like to give you a triad of polyarthritis, cutaneous pustule slash papules, and tenosynovitis, which is inflammation of tendon sheaths. They can give you a de Quervain tenosynovitis. It's of the wrist, the radial aspect of the wrist. It's kind of buzzy. It's not mandatory. You tend to see that in breastfeeding women. De Quervain tenosynovitis, but they like that as an example of the tenosynovitis that they'll use also with disseminated gonococcal infections. Now, in this case, I sort of gave you an amalgamation of the two presentations. I gave you arthritis, and we have the cutaneous pustular. NBME does this. They show you an image very similar to this, and herpetic Whitlow is fucking wrong. You need to know this is not a vesicle. This is a pustule. It's actually an abscess at the level of the skin, okay? But the arthritis, as I said, gives it away. We treat gonococcus with IM ceftriaxone classically, and mechanism of resistance is a beta lactamase that's extended spectrum, okay? So you just need to be aware of that for USMLE. And of course, you would co-treat. If you're treating gonococcus in any capacity, you're always going to co-treat. You'll give, for chlamydia, you'll give oral azithromycin or doxycycline along with it, along with the ceftriaxone. Let's just hop to the final answer choice. RNA synthesis inhibitor, wrong fucking answer. Could refer to ribavirin. It's a drug that can theoretically inhibit influenza. It's not really going to show up on USMLE. Back in the numerical step 1 era, we used to memorize a bunch of things about weird drugs. Ribavirin causes hemolytic anemia, OMG. Doesn't fucking show up, all right? Inhibits RNA polymerase, also inhibits purine synthesis, bunch of garbage. Wrong fucking answer. You know the deal. When you make more content, I'm subscribing. Appreciate your time. That's it.